Ladies and gentlemen, welcome to the MedTech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technology. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show.
So today on the MedTech Impact Podcast, we're delighted to be joined by Dr. Nikolov, Chief Medical Officer of Cellsound Aesthetics. Welcome to the show, Nikolov.
Thank you for having me.
Well, delighted to have you on. I feel like we're touching on a topic and a technology that's very much trending right now. And clearly you have a different use case for this. So excited to share that with the audience. As always, when we get started in these conversations, we do like to frame it for listeners. So maybe you could tell us, what is that big problem you're looking to address?
Well, right now there are several problems in the aesthetic industry, and especially the non-invasive field. If you look at most devices that are treating rejuvenation, any kind of improvement in the skin health, as well as trying to contour the face or the body, all devices are causing some kind of an injury. You're causing inflammation, a minor injury to the tissue, and in the healing, you're trying to get the improvement. In our device, we're trying to overcome all these things and do it in a non-traumatic way where we heal the tissue as well as achieve all of the above.
Amazing. And maybe we could give the audience a little bit of context from your personal background. What drew you into this world of aesthetics?
Well, I'm a plastic surgeon. I'm a surgeon at heart. I like operating. I like doing things in the operating room where I see an immediate result. That's what's gratifying. But what's more gratifying than that is to be able to get to the result that I want without creating downtime, without creating trauma for the patient, no healing time, and for them to be left with better tissue, better appearance, happier, and for that to be done in the least invasive way possible. So if I'm able to achieve that, as much as I like being in the operating room, I'm happy to sacrifice that because I feel I'm giving the patient a better way of getting to where they want to be. And as you can imagine, that's just as gratifying.
Yeah, imagine it's so interesting knowing your profession, because when listeners are thinking about plastic surgeons, they might often think of that as being a fairly invasive process. And so it's really cool that you're talking about this minimally or non-invasive approach. When you think about that, and the listeners might think about different ways, like what are you seeing that's maybe the challenge in the market in terms of whether that's creams, ointments, technologies, what for the customers are they having to overcome when they're trying to find solutions right now that actually work?
Well, I started a long time ago, and I was probably the first or second user of the InMode products with Body Tight, Face Tight. I did the first Morpheus 8. And for a lot of those that don't recognize the names, that's radio frequency technology. At this point, every single med spa probably in the country has a Morpheus 8 because it's gotten that prevalent and it works. And I have to say, it works well. So there is nothing wrong with it. But one thing, it causes inflammation. It causes micro-injury. And yes, there is a downtime. There is the chance that you may create a long-term problem, a long-term injury as a result, scarring. And you can treat patients only so many times when you're causing injury. You can fry the skin only a few times, and after that, it fights back. It doesn't want to get better. It actually gets worse. I like that technology. To tell you I don't use it, I still use it in certain occasions. I think it's great at what it provides. However, what drew me to this is I'm able to take the next step. Now I found something non-invasive or minimally invasive. I can make people look and feel better when I can traumatize them minimally. And the next step is, How about no trauma? How about rejuvenating the tissue versus just causing the least amount of trauma possible? And for me, that's where the first step was radio frequency. Fantastic at the time. I think it was the best thing out by far. But the next logical step is Cellsound Aesthetics. Now, that's just as big of a jump forward.
In what instance are your patients like, what are they experiencing? What are the challenges that they're facing where they would, want to have an aesthetic procedure done today? What exactly, I guess, are we focused here on helping treat these patients with? What problems are there?
Well, the patients come in with many issues, as you would imagine. But if I were to speak specifically as to what Cellsound Aesthetics addresses, the device allows you to treat, number one, it improves blood flow of the skin, so it makes it healthier. It started as a wound healing device for wounds that wouldn't heal and weren't getting enough blood supply. So in that sense, that's good for you and improves the health of the tissue. As we age, the blood getting to the tissue, not just the skin, but also the muscles underneath, in the face, in the body, the perfusion is not nearly as good. So we're improving that. We're improving lymphatic drainage. And I use it in many things, but lately with all the issues with fillers around the eyes causing persistent edema, even 5, 6, 7 years later, I'm able to treat that. Okay. It improves the formation of collagen, and so it gives you healthier tissue. The other part, I'm also able to sculpt the face. And in this world, we want to be healthy, but people that come to my office frequently also I shouldn't say very vain, we're all vain. We want to look better. And I can sculpt the face and I can sculpt the body by reducing the fat, the fatty layer, without killing the fat cells, but simply giving them a little nudge, if you want to call it that, where they express the lipids in the bloodstream and they shrink down, but they're still alive, well, and well vascularized. So those are important points.
Sure. Now, I guess that's a nice little segue then to discussing, Cellsound and your technology, and, help us, understand exactly kind of how it works and like what it looks like. Tell us.
Well, it's a non-focused ultrasound. And to differentiate it, most of us, and at least in the aesthetics world, think of devices like Althera, for example, where it's a focused ultrasound. The waves are focused at a predetermined depth at a point where high energy is delivered, and that high energy basically kills the fat cells. As a result, you have a change of contour. If you're killing cells, also, I don't need to tell you, that doesn't feel comfortable. That kind of hurts. In other fields, you will have focused ultrasound where at high intensity can crush kidney stones. It can ablate brain tumors. It can do a lot of things. This is not what we are talking about. To clearly differentiate it, what we have is a low intensity device that is, the waves are unfocused, so it doesn't injure any tissue. What it happens to do is throw the cells in a hyperresident state. And when you do that, when we're talking about fat, they release the lipids into the bloodstream and the cells shrink down. Now, one thing is going to come to mind, and the first thing people say, well, your triglycerides are going to go up and you're just substituting the problems and it's just going to go someplace else. Well, we have studies to show that triglyceride levels do not go up in the bloodstream, and also that those triglycerides or lipids in general are being used at a much higher rate, metabolic rate, and your metabolic utilization of everything else also goes up after a treatment. So they're being used up, and you're not just kind of taking it from one place and sending it someplace else.
And I was reading, on your website, there's what seems to be this, electrosonic type of feature as well, electro stimulation. Is that how the electro stimulation is being developed through those ultrasound waves?
Well, I'm glad you brought that up because there are a lot. I mean, your physical therapist probably has some sort of focused ultrasound that you have a little ache in the muscle and they can treat you.
That's right.
Obviously, this is specialized for what we are doing. However, the most important thing is the patent technology with the electrodes. And the electrodes allow you to treat as long as you'd like. In general, if you use unfocused ultrasound, the body itself, the skin, will develop an impedance to the waves, and 2-3 minutes later, you no longer are able to treat, or you can treat, you're just not getting anything out of it. It's a waste of time. With this computerized synced treatment with the electrodes delivering and changing the electrical field and being synchronized with the ultrasound, this allows you to treat as long as you want. And that's the reason why we can achieve the results we want. We can treat as often and as frequently as we'd like, and not be a waste of time, but whatever you do, each minute counts and you're getting a better result. That's actually the best part about the device. That's what makes it work.
Well, it sounds like it's got a lot of plus points. And so maybe you could tell us a little bit more about, how have you managed to get from what's been a technology that's been around for a little while to be able to deliver this therapy? I mean, what's the kind of some of the science? If you don't reveal the secret sauce, but you can tell us a little bit more about how the technology actually works.
Well, I'm going to start with an anecdote, and hopefully our chief technology officer who invented the technology doesn't mind me sharing this, but I find it quite interesting. The story that he has told me is that his wife, well, her father, his father-in-law, had a really bad non-healing diabetic wounds and went through a lot of treatments, and it was problematic, and she was frustrated, he was frustrated. So she went, it's like, Elon, you do all these things for everybody else. This is my father. He's suffering. Can you do something for him? What can you do? So he designed this machine. And literally, he designed it to help his father-in-law. Sure enough, he saw it works. It works well. So it's, well, we could use it on other things. Let's try it. So all of a sudden, it started being a wound healing device. And we have a lot of studies, documentations of wounds being treated. During COVID, they treated a lot of the COVID lungs that are whited out. Of course, that's totally off-label, to be very clear. They were in desperate situations, but they saw improvement because the congestion was relieved. And the beauty of it is also you can contour. So now, and of course, only when you want to be very clear, you can decrease the fatty layer or not, depending on how you treat it and what settings. But if you can contour, in today's world, we all can kind of lose an inch or two of fat somewhere on our body, or maybe a little bit of that double chin. So eventually evolved to being contouring, not just wound healing and improving the health of the tissue. So that's kind of the way the device evolved.
An amazing story. And again, we always often hear this about the personal element of why technology gets created, and can definitely relate to this time of year, the need to maybe lose a little bit more fat that we gained through that winter period. It's been a little bit colder here, and again, there's maybe 1 or 2 extra layers that need to be shed as we turn the corner to springtime. And for people listening in, I'm sure they're kind of interested to know more about this process. Kyle, it sounds pretty attractive. It's non-invasive. It's like, it sounds like there's no pain element to it. So again, it could be pretty attractive. Maybe you could tell us a little bit more about that step-by-step of, what does that procedure look like? How long does it take?
The procedure, we have a protocol, and the protocol is doing 2 treatments a week for 3 weeks. So that's the official protocol. And I have a lot of patients from out of town. Frequently, I may do 3 treatments a week for 2 weeks. Now, if you did a treatment every day and you did them one after the other, it doesn't mean you don't get the effect. It's just not as effective. So it's not going to cause any damage. You're not harming yourself. You're not frying the tissue, but you're not going to get as good of an effect. You want to give the tissue a little bit of a break to clear out to get the full effect before you go to the next treatment. So 2 treatments a week for 3 weeks. Each treatment lasts on the average about an hour, although the actual treating time is half of that. But there are photographs, and I'll get into that, where we have standardized photo to document the results and actually measure in centimeters the amount of change we've achieved. An hour later, you get up, you go. You can go to lunch, you can go to dinner, you haven't been tortured. If it's treatment on the face, the one thing is you have to reapply your makeup. So I always warn women, of course, they never travel without makeup, but nonetheless, be prepared if you're going somewhere. Most of it goes. And that's basically it. There is no downtime, no discomfort during the treatment, no pain whatsoever. You're not injuring tissue. You're not killing anything. You're not even causing inflammation. Quite the opposite. You're improving the health, you're improving blood flow. And that's why it's so comfortable. I have to share one thing, and to a point where it's gotten to be occasionally a frustration, because it's so comfortable and easy to do. Patients feel like, well, this couldn't be doing that much. I'm not feeling any pain. What's wrong? So they question the results until they see them in pictures and on the camera. They think this couldn't be doing that much, but it feels better and it looks better right away. And the proof is always when you see it, you believe it.
Now, how about the go-to-market strategy here? If I'm a patient today, and I want to go have this procedure done, and you're over here, I would imagine selling these devices, these units, and your technology to an end customer. What does that look like?
We're selling the devices as a company. At this point, we started mainly with core physicians, core being mainly plastic surgeons, facial plastic surgeons, dermatologists. We've gone through doing some studies, additional studies, and we have studies showing efficacy, by the way, but additional studies showing how the progress is, how much we're losing with treatments. And again, we want to show effectiveness of treatments. However, this device can be used in most states. You have to be a nurse to do the treatment, or in a lot of states, you can just be a medical assistant. It's a class 2 device, so it's not like a laser, and which makes it very marketable, very safe to use. As a result, the market is huge. We have not just physicians' offices, where we market it also not just as being a device to improve contour, to improve tissue health. I use it also after surgeries frequently. 5 days after a facelift, I can do a treatment. So you have that market. And then the second part is I can market it to med spas, properly managed med spas with physician supervision, clearance, because I do believe that's very important. And they can do the treatments just as well, because those facilities are properly managed, but you have to try hard to screw up. You may not get the best result if you're not well trained, but you have to try to screw up. So marketing wise, we have a wide market, wide possibility of being able to distribute the devices to not just physicians, but a lot more than that. And on the other hand, it's safe, so there is no concerns in the use. And We have the proof of concept at this point. We have sold close to 50 devices that are across the country, and I'm not counting devices outside of the US. They've shown that they work, and people feel comfortable, and the buzz is out there.
Is there any type of procedure that you're performing that would welcome reimbursement, or is this mainly out of pocket for the patient?
At this point, this is mainly out of pocket, and we're marketing it as cosmetic,
Yeah.
shaping, rejuvenating device. We're not marketing it as a wound healing device. That's
Okay.
a totally different kind of thing. So it's mainly non-reimbursable. That does not mean that in the future that cannot change, but getting reimbursed as a physician for using ultrasound is pretty minimal. Getting reimbursed for making somebody look better is significantly greater.
Yeah. No, that makes
And
sense.
I don't have to wait for Medicare to pay.
Yeah, exactly.
And you said earlier, those magic words, the proof is in the pudding. I wondered if you could tell us a little bit more about what sort of data you're seeing from the clinical studies, and, the sort of evidence that supports this technology.
I can speak and I can tell you what we're finding because I'm dealing with the studies, and they're not finalized. But what studies we already have, and they're international, showing that over 94% of people saw a difference, a significant difference, and were very happy with the outcome of treatments. And I think that's huge for any device. And knowing, and I'm sure the audience knows a lot of devices out there because we're bombarded with, this is non-invasive, this is going to make you look better. Most of them hurt. Most of them do not deliver the promised results. And I can tell you that because I've used a lot of them. With this, we're showing, and 94, it's almost 95% of people being happy and seeing a significant difference. That is huge. So we also have studies showing the increased metabolic use of triglycerides and lipids, as well as increased metabolic rate right after Cellsound treatment. And I think those are important things.
Yeah. No pain, plenty
One
to
major
gain.
thing, if I may mention, because I think it's game changing, not to overuse that word, but most devices penetrate 1.5, maybe 2.5 centimeters. And so they treat very much the superficial layer, nothing more than that. We penetrate with Cellsound down to 10 centimeters. So everything between 0 and 10 is being treated. And you can address a lot more, you can address a lot deeper and treat it and get good results. And that's unlike anything else that I'm aware of being on the market. So for me, that's huge.
Yeah, I think huge is the word I was thinking of. The fact that you could have that strong feedback, great data now, more data coming around the corner. For somebody listening in and, they want to again get their hands on this technology, what other support? Is there sort of a training program or anything that goes with this?
Well, as any company, the most important thing is I'm very happy for anybody to buy one, but it doesn't serve us. It doesn't serve us well at all if they buy the device and they're not getting the results that they should be getting. That makes us look bad. So the important thing is to train them. We have a training program where it's on site. We have a nurse that goes in and spends at least 1, sometimes 2 days with the customer and the staff, so they know how to use the device. They understand it. There are online videos, which frankly, well, I'm the CMO, so I didn't have to get my staff trained. I trained them. But to be honest, the newest person I hired, she watched the videos and I went in and I'm trying to tell her what to do, and she already knew everything. So I felt, frankly, a little silly trying to tell her and teach her. And she already was, she knew as much as I can teach her on the spot in a few hours. She had already gotten there. So we have a lot of videos, video support, and that's helpful. And also anybody, not just initially, but at any time, if they have any issues or questions, we do have clinical support, nurses that you can call, troubleshoot, discuss issues you may be having, see how they can be overcome. Maybe you're not placing the electrodes right. Maybe you feel like they're not sticking well. Maybe you're not turning up enough. How much should I do on the stimulation on the electrodes? And that's a continuous support that comes not just in the first day, first month, but it continues after that. And it makes you successful when people know what they're doing, how they're using it, they're happy with it, because the whole thing, they'll tell two friends and they'll tell another two friends. So it helps us. And also it's good for whoever buys the machine because they never feel like they're in this alone. We provide help them with marketing material, how to market, and not that it's enormous, but also getting that support. I'm the CMO of the company, but at the same time, I'm also a consumer. I have two of the machines that I paid for, and it's because I like them. It really is something where the support and the comfort makes a big deal. So I appreciate that.
Yeah, I'm sure, Cal. For anyone listening in, it's a nice rounded package. You've got obviously this, plus points for the patients in terms of the non-invasive, obviously getting again good results, and for the providers, you've got that clinical expertise and support. If I'm listening in again, like how would I move forward? What's that kind of next process for moving forward my interest in using this technology?
Any information that someone listening may want to further research or reach out to one of them, it's cellsoundaesthetics.com is the website. And through that, you have access to a lot of the clinical information, as well as reaching out and trying to arrange even a demo if one is desired to see firsthand how this works.
And what can they expect out of Cellsound, say, in the next 12 to 18 months?
Hopefully, more great results. For me, again, I'm always a physician, and what drives me is having happy patients. And seeing a patient, we recently treated a celebrity who is actually, I think, going public with having the treatments, but I don't want to mention names until she has decided to do so. She couldn't wait to have more treatments. And not that she's a celebrity, she's a beautiful, kind-hearted person, but seeing her happy, seeing the joy that she gets out of it and looking forward to it, for me, that's what makes me happy. So the most important thing is I look for a lot more happy patients, and I'm looking forward to hopefully people realizing, again, to use the game changer, and it's become a cliche, but how this is changing the playing field. And it's going from tissue injury to tissue rejuvenation while still achieving not only the same results, but in most cases, I feel even better results. So better contouring and healthier tissue. But there is so much fatigue in the market of just another device of just doing the same thing. But yeah, we have a little extra bell that rings when you're done. This is so different that I hope people understand the difference and continue embracing it.
Well, I think, having had Dave Hughes from Novosound on just before Christmas, and as I was alluding to at the beginning, it's so cool to see this application of ultrasound. Again, I think this is a really trending technology. And the point you made there is, you can't put a price on happiness. And so I think the fact that you're helping patients be a little bit healthier, be a lot happier, that's such a great thing. So really delighted to hear about how you're approaching it, exciting technology. And yeah, thank you for coming on today and sharing about Cellsound Aesthetics.
Well, thank you very much. I'm so grateful for you guys having me on the show, on the podcast, and allowing me to share this. And as you can tell, it's something I have drunk the Kool-Aid. I didn't start as a CMO. I bought the machine first, and then it's like, wow, I want to be part of it. So I appreciate having the platform to share my enthusiasm about Cellsound Aesthetics and what it can do.
Love it. Leading by example. Well, ladies and gentlemen, another huge thank you to Nikolov, Chief Medical Officer of Cellsound Aesthetics. And thank you for tuning in to another episode of the MedTech Impact Podcast. I'm Kyle Cruz.
And I'm Richard Beaglejohn. Until next time, keep innovating.